Hi, I'm Dr. Salem Samra. I'm a plastic surgeon, a board-certified plastic and reconstructive surgeon here at the Samra Group. I trained in a great medical school in Houston, Texas. I did my residency in plastic surgery at Yale University in Connecticut. I did a fellowship in hand and microsurgery at Yale, and I'm board-certified in both plastic surgery and surgery of the hand. I initially became exposed to plastic surgery through my family background, my father being a plastic surgeon and my older brother being a plastic surgeon. However, I always wanted to be unique, I wanted to be different, and I wasn't sure that plastic surgery was for me until I saw the field firsthand. I think my biggest challenge as a plastic surgeon is simply trying to explain to people what I do. People have preconceived notions about plastic surgery. They think that we're automatically a certain personality or interested in a certain operation. But in fact, what I do is a wide spectrum of procedures for patients that are in a time of need with regard to a reconstructive problem. My biggest challenge as a reconstructive plastic surgeon is simply educating people about what I do. I think that many people and patients have preconceived notions about what a plastic surgeon is or what a plastic surgeon does. They're not necessarily aware of the fact that I can reconstruct a face after diagnosis of skin cancer. They may not know that I'm a hand surgeon that can help them with the debilitating pain they get from carpal tunnel syndrome. And so it's a challenge to explain to people that plastic surgery is a really wide-ranging, versatile field, and that I can help them with both their medical and aesthetic cosmetic problems. I think my greatest achievement as a reconstructive plastic surgeon since I joined our practice here is being the first to do many different procedures, but one specifically that comes to mind is the first microsurgical free flap breast reconstruction done at Raritan Bay Medical Center. Being a physician and a surgeon in 2022, you have to be caught up on the latest technologies and the latest advancements in the field. One technology that I actually brought to this practice that I was trained in residency is something called endoscopic carpal tunnel release. That's a minimally invasive way to relieve carpal tunnel syndrome, and patients after a week can get back to their normal activities. So that's one example of a modern technique that I brought to this practice, but techniques are always changing, and it's our job to stay on the cusp of technological advancements in medicine. The honor that I've been fortunate to receive from New Jersey Monthly is with regard to my practice reconstructing patients' faces after a diagnosis of skin cancer and Mohs surgery. I think when you get a diagnosis of a cancer on your face and hearing that skin and soft tissue has to be removed, resulting in a wound, it's scary, and it's a stressor to a patient with regard to how is it going to affect their well-being going forward. How are they going to feel about themselves in terms of their confidence, their self-esteem in their daily lives. And so my goal is to make it seem that the patient never had a cancer diagnosis to begin with. If someone is going to be a patient of my practice, they're going to find someone that's going to make them feel comfortable from the get-go. They're going to find someone who's going to listen carefully to their concerns. I want my patients to be completely educated in terms that they can understand about the diagnosis that they're facing, about the options that we're considering, and we want to make a treatment plan together. So I think communication is super important with regard to the patient-doctor relationship, and I pride myself on my ability to communicate with my patients.